live from the Spero Clinic, Anna, for our third graduation today. How long did you have CRPS before you came?
4 years.
And you have a great big community behind you. I've been watching you on Facebook, cheering you on and watching today.
Yep.
How bad was your pain coming in?
When I came in, I was on crutches and only walked on the outside of my right foot. It was completely turned in and purple and blue. I wouldn't wear shoes or anything like that because I would well black out from this touch.
Look at your cute boots.
Yep, this was a goal of mine, to be able to wear heels for graduation.
They're super cute.
Thank you.
So I'm going to give you the floor.
All right. So to be able to really capture my journey that got me here, we have to start way back in 2004. I was diagnosed with non-Hodgkin's lymphoma of the T cell. Non-Hodgkin's lymphoma is a cancer that attacks the immune system. When it attacks the T cell instead of the B cell, it is more difficult to diagnose and cure. Most people who get this type of cancer are farmers and older men. We don't know how I ended up with it because, as you can see, I'm obviously neither of those. In 2004, I was in first grade and my doctors had diagnosed me with asthma because I was having trouble breathing. Starting in August of that year, I had gone to the doctors 2 times per week where they took many x-rays and did a lot of blood work, but nothing important ever showed up. As school started, what we thought was asthma slowly progressed to something worse. I couldn't walk and breathe anymore without getting blue in the face. Finally, on November 17th, my mom picked me up from school because I couldn't walk and carry an empty backpack at the same time. On that day, I couldn't even walk to the car. My mom took me straight to the ER and they diagnosed me with pneumonia and sent me immediately to the ICU because both my lungs had collapsed. While in ICU, I was given a chest tube, which had to be put in to drain all the fluid from my chest. Eventually, they took me to the main floor to do a CAT scan, and this is where they found 3 tumors. One tumor was sitting on top of my heart and was the size of a softball. The other 2 smaller tumors were on the back of my heart. So in the early morning of November 18, 2004, I was diagnosed with non-Hodgkin's lymphoma, and from that moment on, my life changed forever. Because I was only 7, I didn't really understand what was happening to me. I remember seeing my family so upset around me, but I didn't grasp why. When they attempted to tell me about my diagnosis, my response was, thank goodness it's not asthma. And oh boy, do I wish that was the worst diagnosis I'd ever received. I had no idea that cancer was so much worse, and I had no idea the impact this diagnosis would have on the rest of my life. It took a while for this information to sink in, and finally, I realized the gravity of the situation when I was told that my hair would fall out. I sobbed for a good hour and made all the nurses and doctors in the ICU cry. I spent the rest of November in the hospital, and on December 1st, 2004, I was allowed to go home. After being home for only a short time, back to the hospital we went. This time, I had a staph infection. The next time I came home, I got to return with an IV and a new form of chemo. And that's when we noticed that the chemo was affecting my brain. I went back to the hospital for tests. The tests consisted of basic math problems, problem solving, and pattern recognition. I couldn't do any of them. So they took me off that chemo and started another one, which brought on many new side effects. I had to be admitted to the hospital every time I received the new chemo, and the next day I would always need blood and platelets. If there was even the slightest chance of a side effect, I would get it, and that still holds true today. For a while, life plateaued, and we thought we were okay and had gotten used to this new life, and I was getting close to going into remission. But on May 3rd, my mom asked for a CAT scan because I started to cough at night, and she was getting worried. I went for the scan, and the radiologist said we would hear from them by morning, which, spending as much time as we all do in healthcare settings, you all know how very unusual this is. On the morning of May 4th, the phone rang, and it was my doctor, telling my mom to bring me in right away. My entire family met me at the hospital, and that is when my doctor showed my parents the scans and told me that my cancer was back to its original size. As my doctor was informing me of my relapse, in my mind I was prepared to ask what the next step was. But when I spoke, all I could say was, "Am I going to die?" My doctor told me he was going to do everything he could not to let that happen. He decided on bone marrow transplant because the chemo wasn't working. However, I ended up not being able to get the transplant anyways because my liver began to shut down and I went into respiratory arrest, which meant I would never survive a transplant. Luckily, my doctor came up with a group of 7 different chemos to give me, and they miraculously worked. I continued to take those and ultimately live at the hospital for the following 4 years. I thought 5 years of battling cancer was going to be the toughest journey of my life. However, it was only the very beginning. I always correct people when they ask me if I'm cancer-free by saying, "No, I'm in remission." You are never cancer-free. Cancer follows you around for the rest of your life. After decades of facing the harsh consequences of chemo, such as heart and lung issues, impingement syndrome in all my joints from my growth being halted, a compromised immune system, and soon thereafter to be found out my nervous system had also taken a huge hit. I spent most of high school and college managing these different issues, and I thought I had seen the worst of it already. However, flash forward to Christmas Eve of 2019, I woke up in excruciating pain in my right hip and thigh, and the first thing that crossed my mind was, "It's back." However, I had no idea I was about to battle a much larger beast. After dozens of tests and scans and receiving multiple misdiagnoses, we thought we had finally found the answers we were looking for, a labral tear to my right hip. Trusting my doctors, I went ahead with surgery to repair the tear. I woke up from that surgery feeling like my body was being burned alive. Looking back now, obviously I know it was actually the surgery that had spread my CRPS to my entire low right side. I stuck with physical therapy for months afterwards with no progress. I had finally had enough of doctors telling me that I was overreacting and just sending me back to PT. So I called my oncologist and requested for him to take a look at my MRIs and see me for a consult. I had this bad gut feeling that something wasn't right as I just continued to get more and more sick and the pain continued to worsen and spread. My oncologist, who finally gave me my diagnosis of CRPS and had explained how my chemo probably played a large part in causing chaos to my nervous system. And that same thought went through my head again, hearing this diagnosis. Dang, I wish it would have only been asthma. But I was so relieved to finally have some answers. But that feeling didn't last long, because I made the mistake that most humans do when receiving a new diagnosis. I Googled it. I was quickly overwhelmed and heartbroken when I read the words incurable. After the next few weeks while waiting to get in with a pain and spine clinic, I was slowly being drained of all hope. I was horribly angry with this diagnosis, and I spent a majority of that first few weeks just laying in bed screaming and crying in pain and praying to God that they just misdiagnosed me again. I spent way too much time and energy on trying to find another reason for my pain other than CRPS, and this caused me to steer away from using my little energy to start treatments. I was in so much denial, and I was grieving so many parts of my life that I thought I would lose forever. For the first 3 years of my CRPS battle, I exhausted every treatment option that was available to me in Michigan. Every doctor I saw would just pile up new meds to the point that I was taking about 20-something pills every morning and night, and that is not counting all the pain meds and muscle relaxers I was on. I was completely numb to the world, and I had no personality, and all I wanted to do was sleep. I started having more and more new symptoms showing up every day, and my pain doctor was no help and just continued to gaslight me and upped my meds. As time went on, I became sicker and sicker, and we decided to agree to what we thought was my one and only treatment option left, the spinal cord stimulator. So in December of 2021, I did the trial, and there was some disagreement beforehand between my surgeon, the stimulator rep, my parents, and I. With the amount of area on my body they would need to trigger with the stimulator, I would require 4 wires to be placed. My surgeon did not want to place more than 2 wires for the trial because it was just a trial. However, to qualify and have insurance cover the stimulator, I needed to get at least 60% relief from it, and if there are only 2 wires placed, it wouldn't even cover 50% of my pain regions. The rep, my parents, and I all agreed that we needed to make the trial as legit as possible, so my surgeon was outvoted and was taking it like a punch to his ego. So they took me back to the procedure room. By the way, they do the trial under twilight sedation, so it was just a ketamine and Versed mix, so you're still awake, but it's all very foggy. So the first 3 wires went in fine, but when it came to time for the 4th one, my sedation had completely worn off and my body began to convulse in pain, which started to make me freak out because I really didn't want them taking a needle to my spinal cord as I'm shaking all over. So the nurse asked if she could push more sedation for me, and my surgeon said, and I quote, "No, just hold her down." So 2 nurses put their weight on my legs, and then the other nurse and the stimulator rep held me down by my arms. And the rep got in my face and just kept saying, "I'm so sorry, I'm so sorry." I felt everything on the last insertion, which was down by my tailbone. So by now I have tears streaming down my face, and I was blacking out from the agony I was in. So when they brought me back to the recovery room, my body was still convulsing everywhere, and my back was so inflamed that when they tried turning the stimulator on, my leg went flying upwards. So until the inflammation went down, I was unable to turn it on, and the swelling ended up not going down until the last 2 days of the week, because the last wire they had placed kept pulling on my spinal cord every time I would sit down because they taped it too tight. So I got to officially use it for a day and a half on an extremely low setting. Because insurance won't cover another trial, I had to pretty much take a shot in the dark if I wanted to have the surgery or not to place the permanent one. Now we thought this was pretty much the last hope for me, so we went ahead and did the surgery. I had the surgery last February to place the permanent one, and by day 2, I was showing signs of infection. As most of us are, I'm extremely in tune with my body, so I knew 100% sure I had an infection brewing. So I called my surgeon, but he refused to believe I was infected, so he told me to call him again in a day or 2 and send him a pic of my incision if things don't improve. So 24 to 48 hours later, I messaged him and said things weren't improving. So even though he made sure to tell me that this is extremely unlikely that I had an infection, he'd call me in an antibiotic if that would make me feel better. So I picked up the antibiotic and started taking it, but little to my knowledge, the infection was already deep in the tissue, and the antibiotic he called in was for skin infections. So as the days went on, the infection just continued to worsen, and my incision began to drain brown and green like fluid, and I was just soaking through bath towels. That's how much draining there was. And by day 7, I had 104 temp. I was completely out of it and not making any sense. So he took me into the ER, where they told me if I would have waited 12 more hours, I would be dead or in a coma, because by this point I had gone completely septic and my body was shutting down. After doing tons of IV antibiotics in the hospital, I was finally cleared to go home. I continued on oral antibiotics, but every time we would try to go off of them, the infection would just return. My surgeon finally called me and informed me that I needed to have the stimulator and wires removed before the infection travels to my brain, because the infection had corroded the battery and the wires, and so the infection would never clear completely if we didn't remove it. So I had it taken out at the end of February and began healing to prepare my body for a new one to be placed in April. However, that surgery was canceled because the infection had come back and I went septic again and ended up in the hospital. When they removed the stimulator, they never removed any of the dead infected tissue, so the infection had just continued to brew, so that meant I had to have another procedure to drain the area and clean it out. By this point, I was just fed up with things, and I was so exhausted mentally and physically. I didn't know how much more I could take. I went on to tell my surgeon I did not want to reschedule another insertion of the stimulator. I just couldn't take it anymore, and my surgeon has never spoken to me since. He always sent me to his PA after that. What he didn't know was that I didn't want to reschedule it because I planned on being 6 feet deep underground by the time the next surgery came along. When I had been discharged the second time, I began to search for a hospice clinic that could help me go on my own terms. I had stopped my antibiotics because they were causing serotonin syndrome, which if you don't know what that is, it's like an overdose of serotonin to the brain and can be fatal really quickly. And this was my third time getting it. So I stopped my antibiotics, but infectious disease wanted to see me inpatient again to trial a different antibiotic. I did not want to go back in because at this point nothing was working in my favor and I had just lost all hope and motivation. I thought I would never be anything but the sick girl and I would have to continue to rely on others. However, I'm lucky to have parents that refuse to give up on me. Luckily, my grandma had read Dr. K's book a while back, and so she said to my dad to contact this wonderful place, and he had my mom and I on a plane not long after that to come down to do the intro program. And just a single day here filled me with so much hope and faith, and my faith was restored. Spero gave me something I never thought would be possible: remission. I know I still have a long ways to go in my progress. However, I am stronger and healthier than I have been in a long time. I'd just like to finish this off by saying some thank yous to some specific people. First, I want to thank Riley and Shelly, who became me and my mom's like best friends and rock during all this. I remember seeing Riley for the very first time my second week into clinic. She came back after a rough second week of COVID, and she came in spasming. I looked at my mom with wide eyes and said, if I start doing that, just take me out. And now, of course, we all look back and laugh at this, because about a week or two later, I came out of a vagus nerve with that same look on my face, spasming up a storm, and reminding myself God has a great sense of humor. But when times got tough those first few days, I kept thinking back to Riley's first day and her mom and her walking through the parking lot, and Shelly was almost tipping Riley over in her wheelchair, laughing up a storm. And I thought to myself, I can only hope I could weather a storm as well as her one day. The next day, I reached out to Riley because I felt so alone, and that was the start to a beautiful friendship. Thank you for becoming my mom and I's anchor as we weathered this storm together. I would also like to extend a really, really deep gratitude to Misa. Where is she? Oh, she's right there. Even though you only had me for 6 months, you managed to give me a lifetime worth of healing, and there are not enough words in the English language to tell you how thankful I am to have you as a mentor and for helping me through some really tough stuff. About 2 weekends ago, my pain had spiked and I didn't want to do this anymore. I wanted my parents to take me home, and Misa reached out and pretty much said, give me 110% this week, and if you still want to go, you can go. And so she pushed me harder than I've ever been pushed before, and I managed to hit those pain drops, and because of her, I'm now able to go home and manage this on my own. So thank you again, Lisa. I love you, and I wouldn't be here without you.
I really enjoyed working with Anna because she did come in here every day and worked her butt off, no matter what I asked her to do, whether it be a wall sit or some new movement that she fatigued so hard at, she would fall on the floor, pretty much.
I knew better than to tell you no.
I also learned a lot by working with Anna because of the tics or the twitching and everything. It was really cool for me to learn how to deal with that, how to work through that, because it was new for me. But I love working with you, and I'm super proud of you.
Thank you. And I'd just like to finish it up by saying thank you to all the amazing staff and doctors here at Spero. I like to call Spero the most magical place on earth for CRPS patients, because it's truly more exciting than Disney World. So thank you for all you guys do, and you guys put your heart and soul into every single patient, and you are truly changing lives. Thank you.
this bulb or find your reason growth.